Hi and welcome back with me, Kelly Rogers. We're doing simple skin cytology. This is the second part of this lecture. So now I'm just going to talk through with you a little bit about how we obtain these samples. Now we've run through the equipment we use and how we stain here at the hospital, what equipment we need to be able to obtain these samples, and then we're going to go through some interpretation of some slides of things that we've seen here within the hospital, some of our more common things. So we're going to start with the collection of hair plugs. This here is an image of the equipment you will need for your hair plugs. So this is, again, you've got your slides, your cover slips, you've got your liquid paraffin, your artery forceps. Again, we use sterile ones here at the hospital just to prevent cross-contamination. I've taken it out of its slip here just so that it didn't create almost like a shadow on the image here, and our all-important pencil. So this is a dog receiving a hair plug sampling. So what we do is, as you can see there, we've got our all-important gloves on. You want to just identify an area where you want to obtain that sample, and you want to go in with your artery forceps. You want to go in ideally mid-shaft. This is so that we are able to assess the hair at the root, because that's where the most important information is. We want to know what phase of growth that hair is in. So we don't want to go too high up on the hairs, and we also don't want to go too low, because we want to be able to differentiate if this animal is, in fact, if it's itchy, particularly if it's chewing, really over grooming of those hairs and things. So ideally you want to go really grip it around about mid shaft, because we're not really interested in the information that we are going to garner there. So you just want to go in and just give it a very small tug. The animal shouldn't react too much. It's not dissimilar from just removing a few eyebrow hairs when you pluck your eyebrows. It shouldn't be too uncomfortable for them to gain that sample. So this is the hair going onto a slide. I've got a slide. The slide on the left here is me placing the hair into a preloaded slide. This slide already has liquid paraffin on it. I find it easier to place the liquid paraffin and then the hair on top, rather than place the hair and then trying to fish around for the best bits to put the liquid paraffin on. I find that the hairs actually settle quite nicely when they're in the liquid paraffin. And then the next slide here, we can see that's with the hair with a cover slip on top. So you're going to need your cover slip just to squish everything down, and just keep it all nice and contained. So when would we do a hair plug? Hair plugs are absolutely brilliant if we suspect that there are burrowing ectoparasites present. So things like your demodex, your scabies, things like that. These live within the follicles of the hair, and they're very, very beneficial to finding these parasites. So we always start under a number 4 magnification here, but mites are usually found, because they're so difficult to find, we normally find them more around the 10 and the 40 lens. We're quite see-through, so make sure that you've got your light nice and low. It'll prevent less of it shining through those mites should they be present. One piece of really valuable advice I would give you is if you are looking to find these, if you really suspect, if your patient's got very red eyes and things, and you're thinking, I'm really sure this is a demi patient, if you just take a moment, so get your slide set up, get it all within focus, and then just stop for a few seconds and just watch that slide. Those mites will eventually start to move. It's inevitable. So it's very, you can scan through it. You can be doing your battlement technique when you're looking at these slides, but you're not going to be picking up on any movement if you're going too quickly. So I would always advise somebody just under a number 10 or a number 40 just to stop just for a few seconds. If you think you've got something that you think is a mite, just stop for a couple of seconds, 5 to 10, and just watch. Just watch. Is it moving? That will give you a lot of extra information. One other thing that I would really like to highlight is at the hospital, we no longer take skin scrapes. We only do hair plucks. We find that we don't actually garner any additional information from skin scrapes that we don't from from hair plucks. We find that we are able to gain the same amount of information. The only thing that we find skin scrapes do is further traumatizes already very traumatized skin. So we don't tend to do them here at the hospital anymore. So here we have some of the ectoparasites we were talking about previously. You can see 2 at the very top there on the left-hand image, and then there is 1 down the bottom. These are Demodex. They are described as cigar-shaped, and these were found under a ×40 focus. You can see what I mean when I say that they are very see-through. They're near invisible. If you turn your light down, you will create shadows, so you will be able to find them a lot easier. And then the other image is that's a sarcoptic mites, that's sarcoptes. They like to burrow as well. They don't move very quickly, but if you watch them, it will move. So this here is an image of a hair follicle. So this is the top of the hair, as I was talking about. This hair is in the anagen phase. So this hair is still growing. That's what this means. And they're described as golf or hockey stick shaped. It's like a little hook. And this tells me that this hair is still in the growth stage. So I know that this animal has a hair, at least one hair that is growing and is quite happy to do so. This hair is in the telogen phase. The telogen phase, this I know it looks very, very, very different, but this is also a hair follicle. And you can see the difference between the two. This one's very straight, very raggedy. This is finished growing. All the hairs in telogen phase are finished growing. So this hair is falling out. We see these with alopecia cases. This is something else we see quite often, particularly in itchy dogs that are over grooming. This is a chewed hair, and this is how they present. So this is the end of the hair. So we've done the top of the hair. This is the end of the very end of the hair. A lot of owners will say, "Oh no, I don't see them itching. I don't see them chewing." This hair tells us otherwise. So this animal was doing it maybe when the owner's not looking or is at work and things like that. But this animal is definitely itching to a degree where it is affecting its hair. You can see it's all very, very raggedy, very cut up. So that was our hair. We're now going to look at sample collection for sellotape strips and impression smears. So this is the equipment we need. I managed to get the gloves on this image. We've got our slides, sellotape. Again, we try to use Scotch tape here at the hospital, which is a really lovely brand, with the dispenser. We highly recommend the dispenser if you don't already have one in practice, and our all-important pencil. So this is a picture of a dog. This is a black Labrador receiving a sellotape strip sample from its axillary area. I don't know if that's clear to you there now. I've pointed it out. Hopefully it is. It looks a bit weird, but then usually when I point it out, people know what I'm talking about. So sellotape strips, absolutely valuable for hard to reach places. I love an impression smear, but I love a sellotape strip even more. Really good for interdigital spaces, groin areas, and as you can see here, good for armpits and things. It's Something that we can ask owners to do as well. We can ask owners, oh, if I give you this sellotape strip, would you mind just you know, doing these things for me? And these are really good with these, you know, a lot of these dogs are constantly coming in and receiving repeat consultations. So it can be quite good to be able to say to the owner, like, oh, actually, if I give you the sellotape strip, can you just get this sample for me? And the animals tend to deal with it quite well if they're being done with it with their owners. So what you want to do is just take a good strip of sellotape, again with your gloves on, and you want to just have an idea of in the middle of that sellotape strip. You want to apply that to the area you're interested in sampling, and then either get a really good rub with a finger or your thumb. Really, really good rub, and then lift, very much like a wax. Just lift it up. That's all we need to do there. This technique is no good for ectoparasites. We're not gaining any hair follicles here. We're more interested in this process. We're more interested in the skin at this stage. So this is very good for friends that are crusty or have red spotty bellies, things like that. That's what this is good for, because more at this stage we're more interested in bacteria and yeast, and our magnification won't be under a 4 or a 10. We're not interested in those here at all. We are looking to go straight up into our 40s and our 100 with oil immersion. So this is the tape that I obtained from my friend. So a lot of people have got different techniques. I'll go through what I do. A lot of people loop, so they'll stick the top of the slide, the top of the sellotape, and the bottom of the sellotape with the glue sticking out into the diff quick. I don't do that. I leave it as one long strip, and I stick the one end on the bottom of the slide. I then use my slide to poke, for want of a better word, the sellotape into the pots. Again, I don't use the fixative when it comes to sellotape. That's just going to make that whole thing you see there, it's just going to be very, very cloudy, and you're not going to be able to interpret that at all. It's going to ruin any kind of visual aid that we're going to gain there. So I stain it up, poke it in, stain it up, and this we don't need to allow to dry. We can push that sellotape all the way over to that slide, and then we can just dab it with some blue roll, and then we can proceed to examine that slide. So we've talked about sellotape strips. This is another way that we can gain information. This is an impression smear. And the reason I've done it on the wet nose, I've done it here is on the wet nose, is just to show you really. This particular sample collection is very, very good for open sores, open spots, you know, really oozy things, really, really good for those, not so much for sort of your drier or your crustier friends. So I've done this slide on the nose here just to illustrate. You can see that it's wet. It's a very, very simple process. Again, non-invasive. You just take a slide, press it to the affected area, and then rock, and then pull it off. This one we need to allow it to dry. Otherwise we're going to wash everything off when we stain it. So allow it to dry the way you would an FNA before you put it in a slide container to send off to the lab, and then you can stain it. This one I do use the fixative for. So that's that for that one. The only other time I would collect a sample like this is if the dog was quite crusty. I would never ever pick a crust or a spot in practice, but if something was lifted off as we were examining the animal, what you can do is place that on a slide with some liquid paraffin and a cover slip on top, if that's something you're interested in doing. That's another way of garnering information, although you won't get as much information as you would from an impression smear. I'm now going to talk to you about sample collection for ear cytology. So this is the equipment required: slides, cotton buds, gloves, and a pencil. They don't need to be sterile cotton buds, they just need to be clean. So don't go using them if your vets are double dippers. If this is something you are concerned about, you can always sterilise them. They sterilise absolutely fine in the usual equipment, the autoclaves that we see in most practices. So collection of ear cytology samples. We've really, I need to highlight here how important it is that we are so careful. There are so many nerve endings within the ear. It's a very sensitive area for anyone, let alone an animal that has a pretty active ear infection, which is usually the stage that owners bring their pets to us. It's never, there's a little bit of wax. That's always brought up at time of vaccination. You'll find like, oh, would you just have a look in his ears, just a bit waxy. If these animals are being presented for bad ears, it's usually because they're pretty grotty and they're pretty bad. So I mean, it goes without saying really that these reoccurring ear infections, they are beyond painful. I'd actually speak from experience. I have recurrent ear infections as a child, and I still struggle with that today. I don't have an eardrum in my right ear, and I can gain an ear infection simply from taking a shower and washing my hair. So I speak from experience when I say we really need to be careful. These ears are so sensitive, even when they're healthy. We need to be careful with the way we handle these cases, mainly because we know that ear infections they're recurrent. We see them again and again. So we just need to really bear in mind that we don't want this to be a negative experience, or we want to keep it as positive as possible. So we need to keep that in mind when we are obtaining these samples. So this here is a dog who is having an ear cytology via an earbud. This particular dog didn't have a very bad ear on this day. So what I'm doing here is I'm just pulling the back of the ear slightly, almost cupping that bulb at the back, and then with the earbud I'm using a downward motion. I'm not stabbing it in. I'm not going vertically. I'm going horizontally. I'm not swiveling. I'm not digging around. I am simply going in and twisting. That's all I'm doing. I'm not doing this. That's going to be so painful. We just want to twist and then come out. That's all we want to do there. The cotton bud can then be rolled onto a slide using a rolling motion, and then that can be stained and looked at. So I'm going to play a short video for you now. It's not very long. It's only about 20 seconds long, and this is a technique that is still fairly new to me, but I love it and I think very highly of it. So as I've already touched on, these animals come in with recurrent ear infections, usually very painful. A lot of them do become quite shy to earbuds and things. So me and my vet Steph, we were struggling one day to gain a sample. To my absolute amazement, she popped on some gloves, she did an ear massage, and the next thing I know, she's got two dirty fingers held up in the air and she's going, here's your sample. Dog didn't squeak. All it did was just relaxed into that ear massage a little bit more. So I'm going to play the video for you now. So here we can see this dog. She's not upset by this process at all. She's just having a very intense ear massage. So what I'm doing is I'm coming around the back of the ears. I'm keeping these two up, keep them clean. Massage, in I go. Little poke and out we come. keeping these two in the air. Always best to pre-label your slides in this case, so then you can just come along and dab them on. But rather than a roll technique with this particular one with a glove finger, you want to dab. You want to just dab that on the slide before you stain it up and have a look. But I really, really like this technique. I think this technique is absolutely brilliant, and is fantastic for anyone, any patient that is already beginning to show signs of being head shy, from having, you know, recurrent consultations with regards to their ears. So that concludes section 2. I hope that's helped you gain a little bit of information on how we collect samples and how, as nurses, we can do this. This is nothing too invasive, so we are able to do that. In the third video, I will be talking about how to interpret these and what we find on slides and things like that. So I'm going to be pointing some bits out to you there. So I really hope you can join me there.